you also start seeing the seasonal flu in October. And this year, of course, we have COVID-19. So, how are we supposed to tell the difference between those three things? Dr. Al Johnson joins us here on AM 950 KPRC. I know you work a lot with allergies, and I know one of the biggest things that most people with allergies do is they sneeze. Sneezing has nothing to do with COVID-19, right?
Generally not. Now, it can, and there can be nasal symptoms, but not that repeated sneezing that you get with the allergies of achoo type thing. It's well noted with COVID, you may lose your sense of smell or taste, and that's not related to allergies, but the true sneezing is mainly allergy in nature.
Okay. What are some of the other symptoms of allergies that are exclusive to allergies that you're not likely to find with COVID or the flu?
Well, mainly with the seasonal allergies, and that's spring allergies and fall allergies, it's due to outside pollens. So in the fall, it's ragweed and some of the trees. Mold could be out there also, and of course, you're in Houston, and you have all this damp weather down there, so molds could be. Generally, the seasonal allergy people are worse outside than indoors. They get sneezing, as we talked about. They get itchy eyes. They get runny nose. They can get itchy ears. And then in some cases, it produces the asthma or the wheezing, which may be confused with COVID, but COVID is that shortness of breath and cough in a severe manner that's not related to the gross secretions you get with runny nose from the allergy part of it.
I would think, too, Dr. Johnson, kind of the bottom line with allergies, unless you just all of a sudden develop one, and I guess you could, people do, if you have seasonal allergies, you know what the symptoms are like. You've had them before. You know about when you get it, and you're going to get it around the same time again, so you just kind of have to not panic and remember about your own symptoms, right?
Right, exactly. And, allergies typically do not produce fever. They typically do not produce the joint pains, the flu-like symptoms, the aching, except maybe in some real severe cases. But the seasonal allergies typically do not do that, where the COVID does.
Okay, I have a couple before we move on to the COVID thing. I have a couple more allergy questions for you. I had an allergist once, and I'll see if you agree with the analogy. Because I said to him, I'm all of a sudden I'm allergic to, and I forget what it was at the time, or I seem to be allergic to it, and I've never been allergic to it before. What happened? And he kind of described it as, think of a bucket, and that allergy, that allergen, is a drop in the bucket over and over again, month after month, year after year, and finally at some point your body says, okay, I've had enough of that, and you develop an allergy to it. Is that how you describe it?
Well, that's one way to describe it, yes. And it can be a combination of factors, though. It can be repeated exposure to the same thing, where finally it triggers your immune system and triggers that allergic response, or it may be exposure to a combination of things. So say in the fall, there's ragweed out there, but you've been living in a damp, moldy home that had water intrusion. Those type of exposures are additive, so it could be the underlying damp indoor environment that has actually built up your barrel, so to speak, and then it's triggered by the ragweed that comes along in the fall.
Yeah, that makes sense.
So there's multi factors you may have to look at. It's just not a one factor item. And then stress
that's a good point.
Trigger the immune system too.
Oh Lord, that's not good. We've been nothing but anxious here for the last 6 months, so that's probably not a good thing. Here's another question I had for you. When I was, it's been a long time since I was 17. About 40 years ago, I developed an allergy to penicillin from just taking it so much, trying to get over. I think it was prescribed. I had mononucleosis when I was a teenager, and I took a whole bunch of penicillin. They kept prescribing it. And finally, I developed an allergic reaction to it. So I haven't had it for 40 years. Now, once you develop an allergy to something, I had this severe allergic reaction 40 years ago. What would happen if I took it again? Would I have the same allergic reaction? Or after 40 years, would my body have sort of reset itself?
It's probably reset itself. A lot of what we were calling penicillin reaction years ago were different adjunct reactions to maybe different things in the product at that time. But if you need it, there are tests then that the allergist or the infectious disease doctor can test you to kind of give you some assurance that you're not going to have an allergic reaction to it.
All right, so you're saying I shouldn't just run out and take it just to see what happens?
Well, if you do, you want to be close to a hospital and have some Benadryl ready, so you don't get yourself into trouble that you can't fix.
Yeah, no, trust me, I'm being facetious. I wouldn't do that. The other thing that strikes me, of course, is October. Not only do you have allergies kicking in, you have the seasonal flu kicking in, which is a coronavirus in and of itself. And then you've got COVID-19. So are we going to be able to tell the difference between the plain old seasonal flu and COVID-19? Or if you get flu-like symptoms, are we going to all have to take a test to make that determination?
Yeah, to really be sure, I think testing is going to be required. Back in the spring when we were following the flu and then COVID came along, all of a sudden the nationally reported number of cases of flu went to 0 and COVID jumped up. So meaning that the symptoms are much the same. It just everything was reported as COVID then, but we were only basing it on symptoms. So if symptomatology-wise, they overlap. So if you think you have the flu or you may have COVID, you want to get tested early so that there can be early intervention and not get too sick. So I think the best thing to do if you suspect that, get a COVID test, and then they can determine whether you have COVID or the flu. There's tests that you can do both with.
Dr. Johnson, for those of us who are looking at the numbers we're seeing with a certain level of skepticism, the thing that I was wondering was, we know there's a lot of federal money attached to COVID-19 diagnosis. So how do we know that the numbers we see on COVID-19 this fall are going to be accurate? How many of them are actually COVID-19 versus just flu symptoms, and it's all getting lumped in to COVID-19 because there's money attached to it?
That's a real good question. I don't know that we can be assured. I think most of the hospitals now on the hospital cases are testing for COVID early on. Anything that resembled what they thought was COVID was reported as COVID. Now, with more testing available, I think we're getting a better idea of who truly has COVID. And I think that hopefully the reports, the real-time numbers as we go along day to day, are much more accurate.
I hope you're right, because I'd hate to think we put ourselves in a position of shutting things down again if we see a spike in numbers and it turns out that it's just seasonal flu and not COVID-19. Although, again, except for the elderly and people with compromised immune systems, there's not that much of a difference, is there?
Right. From a health standpoint, yeah, your likelihood of death in the younger population is not that much greater than the standard flu, from the best we know at this point. It does make sense to, as we go through, to wear masks to protect yourself if you're out and about and exposed to groups of people, because you don't know who may have it or not. But it's good to see everything is calming down mainly. And the one thing that amazes me in this whole process is that in medicine in general, if we treat a disease process, whether it's infection or cancer, if it's treated early, we get better outcomes. A lot of the treatment for COVID has been focused on the later forms in the later disease process in COVID, not how to treat it early and get it under control so your body can recover before the big inflammatory response occurs and you really do have lung problems and lung damage.
We're talking to Dr. Al Johnson here on AM 950 KPRC. He is Texas-based. I thought this story was interesting. As you know, college students seem to be spreading it more than anybody else these days. Here in Texas, the only places where we're seeing some spikes at this point with COVID-19 are college towns, where college students make up at least 10% of the population. Lubbock, Hayes, Brazos have all had cases grow up to 34% since August 19th, mainly because you've got college students who are not as inclined to socially distance or to wear masks or to do anything else an adult wants them to do. So, short of, I'm not quite sure how we solve that problem, right? You either get compliance or you don't, and if you can't get compliance from them, you just have to stay away from them.
Yeah, correct. And of course, I think there was an interview today with the powers that be on the FDA and CDC and so forth that were encouraging if college students got sick that they were to stay in place, and hopefully the colleges would provide a dorm or someplace where all the COVID people stayed, so they would isolate them and not travel and spread it. So they're not, mostly the college kids are healthy. They shouldn't have too many bad side effects and should get through it just fine. But it seems like, yes, the students are going to be more likely to get together and to create a jump in the cases, but shouldn't have dire consequences of severe problems.
Yeah, let's just keep the seniors away from the college students. I guess we'll probably be okay, right?
I would think so.
Yeah. All right, Dr. Johnson, appreciate your time, sir. Thank you so much for joining us today. Appreciate it.
Oh, you're welcome. Stay healthy and have a good evening.
You too. Take care. Dr. Al Johnson checking in here on AM 950 KPRC.